afternoon. Greetings from the Institute of Global Professionals. Greetings from the Institute of Global Professionals. Thank you all for joining us and staying with us till the end. Honorable knowledge seekers, today I am your host for the afternoon. My name is Ananam from Bangladesh. Dear knowledge seekers, I am proud to be associated with IGP. IGP is a social and ISO certified international educational and training institute. In the last 3 years, we have already served 35 million plus knowledge seekers from 100 plus countries. IGP is internationally recognized and globally accredited. We are connected to more than 450 plus professions and 4,500 plus organizations. Institute of Global Professionals (IGP) is the training facility for skill development, which was founded in 2020 and is generating competent candidates to meet demand in the global labor market by providing professional qualifications. The Institute of Global Professionals is an education institute that provides social work globally recognized and reputable. We serve students and community resources providing holistic social work and education. We believe that it's not effective to increase one skill just by acquiring formal education. So, we provide effective training and consultation to generate proficient generation all over the world. We distribute our services locally, nationally, and internationally to students, job seekers, job holders, and also for learners through respective campus locations and distance learning platforms. We are an occupational and dependable institution. IGP is one of the famous online institutes from all over the world. Our vision is education isn't a business product, it's a part of our human rights. Based on our vision, we are trying to reach all corners of the world. For free webinars, seminars, courses, award quiz competition, mentoring and counseling, etc. On the other side, we are also trying to offer more than 100 premium services for free, like creating our portfolio website, resume builder, cover later, motivational later, and world knowledge platform for gathering general knowledge, which can upgrade all day. Kids learning games website, free courses, converter sites, and many more. We help to empower you to learn to meet the expectations and dreams and become highly skilled people. We implement several training programs, webinars, and offline online courses for youth and learners by professional trainers, speakers, and coaches. Our sessions are conducted by global renowned professionals to develop all kind of youth and to promote the education of their abilities and personalities. Spreading knowledge is crucial for the Institute of Global Professionals. We believe that knowledge is love and light and vision. So, we are trying to understand the needs of today's generation and will serve them with good research and practice methods. We must have a genuine concern for the learner. We represent more diversity, growth, and innovation are required. To lead a session with professionalism, passion, and integrity, IGP members are committed to offering best, effective, best quality services and continual improvement so that individuals who seek information can improve their skill levels and value. Before we move to the next, let me remind don't forget to share, tag, and mention your friend in the comment box. Your support is very valuable to us. Thank you. Before we move to the next, let me remind don't forget to share, tag, and mention your friend in the comment box. Your support is very valuable to us. Thank you. Moving to the next, with your continuous support, we have already completed 2,282 webinars successfully. Moving to the next, with your continuous support, we have already completed 2,282 webinars successfully. Dear IGB speakers, participants, and well wishers, at this moment, this is a very important message for you all. We changed and designed our website www.eduigp.com. On this website, we have surprises for everyone. Hope you will be benefited. We already launched our new website where you can find all our previous activities together with lots of new features. But one strong point is that without any account or logged in, you cannot enjoy our services. So create your account for once with your proper information. Note that with your proper information, you will enjoy all features. With mismatches data, you can do anything here. From now on, you have to participate in live quiz competitions on our website, Udiply Slido. You have to join directly on our website. Now you can check all of our previous webinars with verified e-certificates. Now it's easier and time oriented because after this session, we will not provide you with any code for certification. You have to take part in one exam. After that, if you passed, you will receive your certificate, otherwise not. But you can take part in an exam unlimited till you pass. If you are an IGP speaker, you can download all your previous certificates, speakership certificate. If you are a host of IGP, you can download a certificate of gratitude. If you are an online quiz competition winner, you can download a certificate of participation. If you are selected for a lifetime membership, then you can download a certificate of lifetime membership easily. Besides this, if you participated in any award function which organized combined support with IGP, you can download that also. You can instantly prepare and download 18 type of instant certificate from our website within a minute. Certificate of Global Professional Membership, Certificate of Global Influencer during the pandemic, Certificate of Active Knowledge Seeker, Certificate of Social Activist during the pandemic, Certificate of Achievement IGP Knowledge Seeking Campaign 2020, Certificate of Achievement IGP Knowledge Seeking Campaign 2021, Certificate of Achievement IGP Knowledge Seeking Campaign 2022, Certificate of Participation Webinar Series 1 Authentic Assessment in Teaching Learning, Certificate of Participation Webinar Series 2 Teaching English as a Foreign Language and Assessment, Certificate of Participation Webinar Series 3 Digital Classroom Engagement Tools, Certificate of Participation Webinar Series 4 The Nutrients in Education, Certificate of Participation Webinar Series 5 Upskill Organizational Leadership and Managerial Skills, Certificate of Participation Webinar Series 6 Trends in Innovation in Mathematics Education, Certificate of Participation Webinar Series 7 Research a Comprehensive Approach. Certificate of Participation Webinar Series 8 Art in Teaching a Special Program in the Arts. Certificate of Participation Webinar Series 9 21st Century Tools in the Teaching Mathematics. Certificate of IGP Corporate Ambassador. Certificate of IGP Campus Ambassador, which you can prepare and download within a minute. From now on, you can participate in 1000 plus international level quizzes with verified e-certificates. Teaching tips for teachers, health tips for parents, health tips for teens, gamification tools for teachers. You can join IGP Alumni. You can check out our 50 plus premium services websites for free and many more. Dear IGP well wishers, we promised previously, but lack of our technical issues, we are late sending you on time. This is a great opportunity to collect your previous credential. We solve all issues from our website. Now you can enroll, reset password, everything. You can check your dashboard for all webinars details. It's a cordial request to you. Check all buttons and pages on our website. Surely I can say you will be benefited. Thank you. But note that without any account or logged in, you cannot enjoy our services. At present, we are going to start our webinar 2281 and program name is Cancer. Take care, no fear. And our honorable speaker is Sunil Malhar and Kulkarni. And now is a very important moment for me to invite our speaker to IGP with his presentation. Hello, sir. Hello, sir. Hello, sir. Hello? Hello, sir. Sir, I can't hear you. You are not audible. Hello, sir.
Hello, sir.
Hello? No, sir, you are not audible.
No, sir.
Hello?
Hello.
Hello, sir. Hello? Sir, you are not audible. I can't hear you. Sir, can you please join again? Hello, sir.
Yes.
Yes, sir. Now I can hear you. Now you are audible. Yes, sir. Sir, again this problem. I can't hear you. Hello, sir. Hello, sir. Hello. Hello, sir. Hello. Hello, sir. Hello, sir.
Hello.
Hello. Hello, sir.
Can you hear me?
Yes, sir. Now I can hear you, sir. Good afternoon, sir.
Good afternoon.
Sir, hope you are doing great. Sir, on behalf of IGP Knowledge Seekers, wants to hear from you about you, sir. Now the stage is yours and over to you, sir.
My voice is getting to you, ma'am.
Yes, sir.
Yes, okay, ma'am.
Okay, sir. Thank you. Carry on, sir.
Thank you. Hello. Good afternoon. Good evening. Good morning to all. I hope you are audible to me. Okay. Today we are discussing a very important and very useful topic. The title of the topic is Cancer. Take care, no fear. Cancer. Take care, no fear. These are So cancer sign symptoms, screening, diagnosis. Third point, treatment, prevention. Various treatment measures are there: chemotherapy, radiation therapy, surgical therapy, immunotherapy, palliative therapy, emotional and psychological support, rehabilitation, support system by the government. Why do you why do not fear to the cancer? This is very important. So cancer, for awareness, we are celebrating various days. 14 February is World Cancer Day, whereas Hello. Hello.
Hello, sir.
Ma'am, can you hear me?
Yes, sir. Now I can hear you.
Oh, I'm very, very sorry. Due to
Okay, sir.
the network problem, it was there. I changed this. Shall I start and I will finish within
Sure, sure, sir.
stipulated times? Surely. Thank you. Hello, ma'am.
Yes, sir.
My slides are not moving. Yes, it's working. Thank you.
Okay, sir. Sir, if you have to move these slides, you can say me. Okay, sir?
Uh, it, so, what is the problem? I'm not getting from my side.
Which slides you need now?
This is, I think, third slide. You are visible same hand. Yes. From your side it is working. From my side it is not working.
Okay, sir. No issue.
Shall we continue, sir?
Sorry, sir.
Hello.
Yes, sir.
How to continue, ma'am? Will you help me or is there any other way?
Sir, you can start. If you need another slide, you can tell me.
Okay.
Just tell me that move to the next slide. Then I will change the slides. Okay, sir?
It will cause more disturb to you also and all the members also. How you can moving? Will you give that authority to me so I can move?
Sir, then you have to upload this in present sites. Can
It
you
is
see
there.
down in
It,
present?
it is there. On our WhatsApp group, I have posted this PPT.
Yeah, that's why I upload it there. But if you want to from your side, then you have to upload it in present.
Okay. So once again, I will upload. So
Yes,
it will
sir.
be easy for me to operate. Thank you.
Yes, sir.
Madam, I am uploading, but I am not able to see. You have to remove from your side because
Sorry, sir.
I have uploaded, but I cannot see my slides. I can see
Okay.
only what your slides.
Yeah, if I have to move to the another slide, just tell me.
Okay, ma'am. Yeah.
Should I move?
It's better if you are giving authority to me. Okay, ma'am. We will continue the same. I will take your help.
Okay, sir. If you need another slide, just tell me. Okay, sir.
Yes, ma'am. Sorry for the listeners for technical problem. So these are the very important dates are there. Cancer dates. Cancer dates we are celebrating on 4th February worldwide to just make awareness and get the rid of fear about the cancer. Especially for the children, it is 15th February, whereas cancer awareness program is 7th November we are celebrating. Next slide, ma'am. So in our body is made up of the various cells. Normal cells, they are growing with a normal way as we are growing from the childhood to the adult old age or when we are getting any injuries. Normal cell division occurs as the previous cells are there, the new cells will be formed same ways. But in case of cancers, the cells are formed abundantly, very large in number and in an abnormal way. This type of cell formation that is called as mutation. It is abnormal cell division. It is not normal cell as our body parts. This mutation is either inherited or often caused by the carcinogens. Inherited means in our body something disturbances are there. It causes abnormal cells, but it is rare and very rare cause. But because of some carcinogens, what is carcinogens? Carcinogens are the substance which can cause abnormal cells, which we are calling as a cancer cell. These are the two pictures are there. You can see normal cell division, the same cells are there. Whereas the cancer cells, they are different. They are multiplying very fast in abnormal way. At the same time, they are dying also in a fast way. Next slide. Next slide. So there are two type of the tumors are there. Tumors means small growths are there. One is called as benign, second is called as malignant. Benign tumor means this growth of the cells, which is very hard, but it is a concealed. Their growth is limited in a particular organ. The cells will not go out of that tumor. These are called as benign. Whereas malignant, these cells, they are going out of their original part. They may spread to elsewhere parts. This is called as metastasis. Metastasis means cancer cells, they are forming in one organ and they are going to the another organ. They may spread anywhere of the body parts. There are some specific connections are there. From there they are reaching to another part. For example, from the breast cancer cells, they may reach to the genital tract of females. Next slide. Okay, this is the idea is this how cancer is distribution. In case of male and female, as considering the gender basis, there are specific organs are there in female. Most common is cervical cancer and breast cancer. Other cancers are there, like cancers are there, gastric, stomach cancers are there. Whereas in male, mainly cancers are related to the oral cavity because of using various forms of tobaccos, lungs because of smokings are there, and third is related to the testes, secondary sex organs are there. As the distribution, you can see the large numbers of cancers. Mainly we are considering these three: oral cancer, lung cancer, breast cancer, and cervical cancers are there. And these cancers most commonly occurs as considering the age groups, in the middle age groups from 20 onwards up to the 60. It doesn't mean that in other groups they are not found, they are also found. But as compared to child age, adult age, they are comparatively more. And very specific, you can see the differentiation. Females are comparatively less than the male. Next slide. Next slide. So why these cancers are occurs? When these cancers occurs, two risk factors are there. Two risk factors are there. They are modifiable and non-modifiable. Modifiable means we can make changes in our lifestyles, these factors, so we will not get the cancer. But there are some other factors are there which are not in our control. These factors are called as non-modifiable. Modifiable is change. If we are changing, modifiable. If we are not able to change, non-modifiable. Modifiable risk factors are there most common in the various parts of the world, that is a various form of tobaccos. Tobacco is used in the form of snuff, powder, chewing, khaini, gutka, pan masala. There are so many names are there worldwide. So any form of tobacco is harmful. Second dangerous part is alcohol. Alcohol also causing as a toxic to the body. Because of this toxicity, the cells may turn into the cancerous form. Third, obesity. Obesity body mass index we can calculate as our body weight into the height in meters. If it is goes ratio beyond 30, it is called as obese. There are two types of obese are there. Apple type of obese and pear type of obese are there according to the shape. So these first three factors are there: tobacco, alcohol, and obesity. Next one. Unhealthy diet. Unhealthy diet. This is a modern era is there. Most of the members they are eating outside. Maybe very small shops are there, restaurants are there, open areas are there on the road. These are the very unhygienic and unhealthy diet is there. Especially the diet containing very fat animal sources are there. Sugar, salt adding for the storage purpose or tasty purpose. chilies, spicy materials, very common, especially in the adult. Fast foods are there, additives to make it appearance, good taste, smell, or adulteration. Adulteration means mixing of any harmful substance in our day-to-day food. Environment, whatever is surrounding us, that is the environment. Polluted environment inside the home, toxic material in the water, pollution of the water is there. Soil pollution, we are throwing various toxic materials from the soil or plastic, one part of that. These having very bad effects on our support system because soil we are getting food that food we are using. If the soil toxic soil mixed with the water, same water we are drinking. Next six factor is reproductive factors are there. Our sexual life it should be healthy. If it is unhealthy, for example, multiple sex partners are there, early or late marriages are there, not giving breastfeeding to their childs in postnatal period after delivery, poor hygiene of the private part. These are the main six modifiable factors are there that are causing cancers. That's why it is called as modifiable risk factors. Next slide. Non-modifiables. This is not in our control. For example, radiation, especially excessive exposed to the radiations like ultraviolet rays, sun rays are there, X-rays are there. And nowadays we are era of digital era. We are using a large amount, large time television, mobile and computer. These rays are very dangerous and very closely we are using without any protection measure to the cell or to the device. Next, occupational exposures. The adult members, they are working various industries. The industries, they are using various toxic materials in the form of liquid, it may be gases, it may be solid. These toxic materials, these are called as carcinogens. For example, asbestos, cadmium, benzoin, petroleum products are there, arsenic products are there, aluminum, rubber productions are there, radiational certain devices are there, leather industries, coal tar industries, in iron, small parts of the, we can say powder form of the wood or paint. In these industries, these toxic materials cause irritation to cells and they convert into cancer. Next is the infections. So various infections are there, mainly when we are not taking hygienic our body parts, environmental parts, as well as we are not keeping healthy our body. Then the various microorganisms enters in our body. For example, Helicobacter pylori, special gastric cancer can occur. Human papillomavirus, survival cancers in female it occurs. Hepatitis B and hepatitis C, liver cancers occurs. Next slide. Next, genetic factors are there. Our body forms from the genetic structures. These are called as chromosomes. Basic units are there. In case parental gene factors are defective, having certain cancerous structures, so that may lead transmit to their next generation. That is called as genetic source, but it is very less and it occurs only in close relation. If both parents are there, then few of the children may get such type of the genes. Next, the age, especially in the adult and old age. Adult age, because of the wrong habits are there and exposure to the work. Whereas in the old age, especially, their immunity power is reduced. They are very prone to having various infections are there. Next slide. How we are identifying the cancers? A simple, understandable to each and everyone, that is word you can keep in mind is called as caution. 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 C means change of bowel habits. So defecation, whatever waste is there from GI tract, we are daily eliminating it. But if it is changed, sometimes it is hard, sometimes it is liquid, 1 or 2 days or more than 2 days, sometimes we are not passing any change of bowel habits, we are suspect that something is wrong, you have to identify it. Second, A for a sore that does not heal. Here in picture I have shown one part, but the sore can occur anywhere in the part of the body. The sores with the treatment also they are not healing because it is a part of the cancerous. Preventability is increasing or remaining and resisting to the specific treatment. Third, unexpected weight loss. Unusual bleeding from the unusual bleeding from various orifice openings are there. So weight loss occurs easily we can identify by getting the weight. If you are measuring your weight, gradually it weight will reduce within 1 month, maybe 3-4 kg. Without any reason, it is suspecting cause. So out of these 7 words, C for change bowel movements, A for sore throat or any ulcer is there, that is not healing. Third is unexpected loss of weight or bleeding from our body. It may be oral, it may be urethral, it may be any other openings are there, nose or urethra. Next slide. Then remaining 4 words starting with the T is thickening or lump. Thickening of any body parts are there, you have to suspect it is a maybe cancerous. Especially organs as I told in the oral cavity, in the breast, in the genital tract. If you are having any thickening part when you are feeling on palpation or in a lump-like structure, small tumor is there, then you have to suspect related to cancer. Next is a indigestion. Whatever we are taking the food, it will not digest. So how it will be identified? By bloating, acid reflexes are there, feeling not to eat anything, heaviness of the stomachs, or swallowing difficulties are there. So ultimately, when there is indigestion, there will be no ingestion or taking of the food, weight loss will be fast. Next is O for obvious change in wart or mold. Wart or mold, these are the small changes of the skins are there. Rapidly it will increase their size or change their color. Last one is N for nagging cough, breathlessness or hoarseness. Nagging continuous is there, breathlessness there. It is mainly because of the smoking or respiratory infections are there. Then we'll get this idea. So these 7 symptoms, very simple, easy to understand. This with this we can suspect in early stage. Early stage treatment will be 100% cure. Next slide. So this is also important part. What is the right, what is the wrong? We are saying as a myths or facts. Myths means wrong, our beliefs are there, wrong, our concepts are there regarding the cancers. Because of that, many members they are not coming forward to show it, to identify it, and give the treatment. There is nothing that cancer prevents. This is a wrong because prevention, risk factor prevention, 30% disease will prevent. Early diagnosis and treatment, again 30% we are preventing the cancers, and proper treatment, again 30% will cure. So around 90% you can cure the various cancers by preventive measures, proper treatment is there. Second wrong concept is that most cancers are hereditary. No, just only 10% in close relatives are there. Only sons if both parents having such defective factors are there. Third, what to eat or not to eat to prevent the cancer is complicated. No, it's very simple. In your food, you have to use fruits, roots, vegetable, balanced diet. Not fast foods, not spicy, not oily, it's too late to stop the smoking. So any habit we can stop at any time when we are decided strongly, and that will help to prevent serious complications and save your life. Stop the smoking is possible at any time. Better not to start. So at the starting point is easy. It doesn't mean that we cannot stop. We'll stop at any time. Why? taking proper help of medical members, family members, and others. Drinking alcohol decreases the risk factors. This is the wrong ideas are there because this drinking of alcohol, it day by day the dose and is increasing, the frequency is increasing, and it acts as a carcinogen. It causes the GI tract from oral cavity to the rectum. It will cause the various diseases along with head and neck, liver, pancreas. Next slide. Chewing of tobacco is alternative for cigarette. It is a wrong concept because any form of tobacco is harmful. There is no less and more because it contains same. Content will not change. High risk cancers need to get cancer screening. Though every person periodically, at least once in 5 years, undergo the routine investigation, routine checkup. In that, sometimes we may identify the risk factors, cancers in early stage, we can prevent or treat easily 100%. Next wrong concept is cancer is not curable. No. Just I told, preventive measures, early detection, proper treatment, it is a curable one. Cancer is contagious. Contagious means from one person it goes to the another person. No, it is not spreading from one person to another person. In case of parent to child, it is because of genetic transmission. Next slide. Can cancer surgery or tumor biopsy cause spread of the cancer in body? No. Any type of treatment, it is taken strictly with aseptic techniques, that is very safe techniques are there. So there is no chance to spread one part of the body cancer to the any other part of body. You are diagnosed with cancer, you will probably die in short time. No, this fear is very dangerous. We are not dying by the cancers, but we are dying because of the fear. Same fear like if your snake bites are there, if you are having some psychiatric health problems are there, or stigmatic disease are there, AIDS are there. So the person is not dying because of disease, but because of fear it causes. Okay. Only advanced stage, 4 stage is there. Only few cases are there. They may have short life, but with the treatment we can extend maybe 5 years, 10 years, or more than that. There are few examples later on we are discussing. They are completely cured with even serious conditions of the cancer. People being treated for cancer cannot be participating their day-to-day activities. Very wrong concept as cancer patient in early stage during treatment, even after the treatment, it is curable and they can perform all the normal activities. In certain duration, they may restrict because of their some inabilities are there, but after cure, they can become as a normal life. Next slide. So there are various ways are there the giving the names to the cancers. It doesn't make any difference, but for learning purpose, we are giving certain names are there. The cells of the origin. So certain cells we are seeing that where cancer occurs, which may be different cells are there. It may be epithelial cells, it may be connective tissue cells, it may be nervous tissue cell, it may be blood or bone tissues are there. Second, blood. In the blood, as we know, there are 3 types of cells are there. White blood cells are there, medically called as leukocytes. Second, lymphocytes are there. Third is the myeloid cells are there. So WBCs mainly they are helping as prevention of infection, like acting as a military members are there. Lymphocytes also they are helping in the same ways. Along with that, whatever dead materials are there, they are throwing out from the body. So leukemia name caused by the cancers of WBCs. Third is the tumors. Previously short we told that 2 types are there, carcinoma and sarcoma. carcinoma. These are the spreading, fast spreading, invading from lower same part nearby the parts or any other parts of the body. Next slide. Screening methods for the cancers. What is screening means? Screening means we are using very simple measures to identify the risk peoples for the cancers. Risk factor cancers, like I told, caution, it is a simple measure to early identify risk factors or risk members of the cancers. So in whom it is applied? It is applied the individuals who are away from or do not having sign symptoms, but they are having some wrong habits are there. There are three types of screening techniques are used. It may be organized systematic way. It may be targeted screening of the risky groups. For example, the smokers are there, the drug addict members are there. These are the targeted members. And opportunity screenings in a particular area, especially prostitute area. It is related to genital tract screening, or whenever patient comes with certain compliance infections, that is opportunity screening. Screening, simple way, easy to identify, but it depends upon success, awareness about the cancers, come forward, have a assessment, early detection. If it is not there, they will also tell you what are the healthy habits are there, how to prevent. Follow-up is important because once it is cancer is not detected, it doesn't mean that later on it will not affect, because in early stage there may not be sign symptoms. So follow-up is important. And third, motivational propaganda is important because of the stigma, because of the fear, because of the shame, so many members they are not coming forward, especially the females, they are not coming forward. They should come forward because whole families depend on them. What are the benefits of the screenings are there? We are identifying the risk members and diagnosis in early stage. 100% guarantee of the cure. Treatment is earlier and easier because the growth of cancer cell is small. The incidence and mortality is reduced. Incidence means new cases we can prevent there and there, and mortality means death. Death by the cancer will be reduced. So screening simple ways are there. Next. This is a table is there. In simple way, you have to keep and identify very common areas of the cancer: oral, cervical, breast, and testes. So starting from the 30 age to the 65 years, every 5 years, you have to go for screening or certain investigations are there. Some common investigations are there. Oral visual examination is there of the oral cavity with the ulcers, changing of growth in the oral cavity, suspect cases there. Visual examination with cervical secretions, we can identify the cancer as part of this. For breast cancers, just palpation of the breast, it is called as clinical breast examination or cell breast examination. Same for testes in male, this by the palpation we can identify. So every month you have to check for self-examinations. At least when you are suspected, immediately you have to visit to the various government or private settings to confirm it. And routinely, at least once in a year, you have to check these special organs. Next slide. Diagnosis. So there are different ways of the diagnosis are there, but most common by the sign symptom cautions. Second, screening will help maximum, simple, early stage. So it reduces the fear, it reduces cost of the treatments and complications, and it prevents death. So there are few ways are there for the diagnosis. Clinical assessment, cautions, screening is there. Microscopic examination of the fluids of suspected body parts or certain tissues are there. Diagnostics, especially CT, MRIs, we are carried out to diagnose. Then visualization, this is called as scopies. Inside the stomach, inside the lung, they are sending a device that is called as scopes. And you can visualize is the inside part is normal or abnormal, taking up the biopsies are there. So for breast self-examinations, just every month you can check your breast. If it is any abnormal, you have to report. Same for the males, testicular palpation is there. Oral cavity, you can just see in the mirror. You will get the idea is there. And this is very important for the female. Self-examination, self-collection of the cervical fluid. If it is abnormal, is there. Checking of the skins for what or mold, changing in color, changing in size of skins. Simple measures are there. Some specific investigations are carried out to control it. Next slide. So before diagnosis, during diagnosis, and after diagnosis, a very important stage is properly counseling and guidance to the cases. Counseling and guidance of the cases to prepare for assessment, diagnosis, and very rarely, if it is happened, accept it, start to fight it, to cure it. So assemble the medical team because various members are important. Diagnosing the various angles are there. Understood the treatment opinions considering the special physicians are there, surgeons are there, oncologists are there, as well as patient and relative also. Manage the stress. Fear is important. So if you are out of the fear, you will come for screening, you will come for diagnosis, and there is no fear. This fear will increase intensity of the disease and obstructing treatment of disease. Maintain good physical hygiene with the help of various treatment measures. Next. So these are the various treatment measures are there, but very important that prevention is important. Treatment, it cures, it may remain some part of it there. These are there to make it the life maximum to the normal, but best way preventive measures, early diagnosis by screening or identifying the signs symptoms of the cautions. So preventive measures, chemotherapy, radiation therapy, surgery, hormonal treatment, immunotherapy, emotional support, psychological support, dietary support, palliative team care is there, rehabilitation is there, and various government health services are there. Most commonly we are using for the treatment that is surgery, radiation, and or chemotherapy. 2 to 3 modes are there. So altogether they will working very fast. Their sequence may be different depends upon the choice of oncologist or disease stage or type of disease. So preventive measure very important: chemotherapy, radiation therapy, surgery, hormonal therapy, immunotherapy, emotional support, psychological support, dietary, palliative care, rehabilitation, and health insurance. Next. Next slide. So preventive care, just in simple word, healthy habits. So what are the natural, normal habits you have to perform in the same way? Take the home food, clean food at hygienic places there. Take proper rest, exercises there. Avoid these harmful habits, smoking, drinking is there. Regular exercise also important. Periodical follow or health checkup is there, and avoid some radiation substances are there. When you are working in a certain industries, other areas, you have to use certain protective measures. So healthy habits are there. Avoid tobacco, alcohol use, regular exercise at least half an hour per day. Balanced diet with fruits and vegetables, no fast foods. Vaccinations, they are preventing infections, ultimately preventing the cancers. BCG vaccination, hepatitis B vaccination, and human papilloma virus. Pollution-free environment. Keep inside home clean, surrounding clean, ultimately on other areas where you are working or taking education. Periodical health checkup is important, and safety measures you have to use, especially for the radiations or wherever you are working in industries. Should not contact with a carcinogen. Next slide. So what is the goal of treatment? Mainly there are four goals are there. First, it's prevent the spread. Prevent the spread. Means local part it should remain, it should not go elsewhere the cancer tissues. Second, shrink the tumors. Shrink means becoming small and destroy it at fast. Third, eliminate the cancer. Eliminates no any cell or anything will remain in our body. That is called as elimination, eradication of the cancers. So the person will become free from cancers. And if the person comes in the last stage, relieve the symptoms. We are making them easy, free from the certain complaints. So prevent the cancers, detect the cancer early, develop the effective treatments, eliminate the inequities, deliver the optimum care, this medical care along with nursing care and psychological, social support, economical support is there. Okay, proper person you can contact it, optimize the workforce from the lower level to the higher level, from the ground level to the rehabilitation or tertiary care level. Next slide. So in short, we are discussing different type of modes of the various cancer treatments. First is the surgery. Mainly it is used when the tumor is sarcoma, solid localized tumor. So we can remove that affected part and surrounding tissue. There are various ways are there how it is removed. Based on that, various names are given. Just for your information, I have mentioned certain names are there. Radical surgery. Radical surgery means removing the affected part along with the surrounding tissues and lymph nodes. For example, in breast cancers, breast is affected, remove some parts of the muscles, lymphatic glands are there in the axilla, it is removed. That is called as radical surgery. Especially in third stage, fourth stage, it is applied. It remove the entire tumor. Only localized tumor is there, it is removed. For example, in part of the stomach or stomach is getting cancer, so we are removing only stomach, remaining GI system will remain same. Next slide. So debulk tumor. Surgery removes some part and not all part. Only cancerous part will be removed because some surrounding tissues they are healthy and they are needed to perform their activities. They are very vital, especially brain, liver, kidney. These are the important. So we are removing only affected part. Next, if operation is not possible in that test stage, we are making is the cancer symptom. Some obstruction part only we are removing the cancers to make it free, or alternative surgeries we are doing for better or ease the complaints. For example, if you are having some difficulty in the respiration because of larynx cancers, voice box we are saying that, in that cases we are performing the tracheostomy, hold to the trachea above the level of larynx. So in that case you cannot speak, but you can take better respiration. Respiration is there. So surgery is carried out for all three purposes: diagnostics, small part examination, therapeutic remove part. The various ways of surgeries are there, and palliative, like ease the symptom. Next slide. Next is the radiation therapy or radiotherapy is there. These are the radiations are there, rays are there. So the rays they are using in a particular point in high dose, they are killing cancer cells. They are killing the cancer cells. But in some cases, some part of the healthy tissue also get harm because of this radiations. The radiations are given by outside of the body or inside of the body. Based on that, there are types are there. External beam radiation therapy. Like CT scan machine, this is the radiation machine is there. The sources comes from outside, that is called as external beam radiation. Especially to use localized treatment is there of the specific part of the body. Next slide. With the radiational source we are keeping inside the body. Inside the body, that is called an internal radiation therapy. These sources are kept nearby the organ or inside the organ. The terms are used brachytherapy. Brachytherapy means the radiational source we are keeping nearby the organ in the form of seeds or ribbons or certain capsules are there. Next is the systemic therapy. Especially we are using for the blood cancers or the various peripheral part of the cancers. This radiational source it is given in the form of liquid through the blood. It reaches to various parts of the body. Along with blood source, we can use for the swallowing through the digestive goes to the GI tract and other parts of the body. So this is there from the inside or outside. That is called as internal radiation. Next. The uses when it is used as a combination of treatment, cancer therapy, radiation surgery, and chemotherapy is there. It is reducing the size, it is treating, or it may help combination of the treatment. That's why it is given. Next slide. Next, chemotherapy. It is also called as cytotoxic therapy. Cyto means cell, toxic means killing the cancerous cells. So chemotherapy, the treatment drugs are used to stop the growth of cancer by killing them or stopping them from the dividing. In the early stage, the cancer cell will not divide, or if it is divided, it will be killed by chemotherapy is there. It is given by the various routes are there. It may be oral, it may be injectable, through the skin applied, it is there, various parts, especially abdomen, that is called as peritoneum. So these are certain examples of the drugs are there, the names are there. Next slide. So chemotherapy is given orally, intravenous, intra-arterial means arteries we are giving, especially affecting to the blood and lymphatic tissues are there, intraperitoneal, inside abdomen, and tropical, especially for the skin cancers are there. How it is killing, there are certain words they are using. That adjuvant therapy means adjuvant, they are killing the cancer cells after surgical combination of that. Then neoadjuvant therapy, chemotherapy, this helps to destroy the tumor prior to the surgery. So chemotherapy is given first, reduce the size of tumor, and then surgery is carried out. And third, it helps to shrinkage of the tumors just to relieve certain symptoms. That is called as palliative chemotherapy. Next slide. Immunotherapy. Immunotherapy, we are giving certain immunizations. Vaccines are there to prevent or to destroy cancer cells, or these vaccines will increase our immunity system to fight against the cancer cells or toxic cells. Especially they will prevent the infection, no irritation, there will no cancerous form of cells. Especially also helps to increase the blood cells, WBC, white cells are there, lymphatic cells are there, and healthy tissue organs to fight against cancer cell. Next slide. Targeted therapy. This is a new concept is there. That means whatever we are using various drugs or hormones or certain vaccines, they will react to particular part of the cancer. Particular part of the cancer, it will not affect any other body part. If you are doing orally, it will affect whole GI tract and then goes to the cancer spot. But here we are using some special techniques, special drugs. They will affect only on cancer cells where they are. That's why it is called as targeted therapy. Yes. The actions, these are similar actions are there. Increase our immunity system and destroy the cancer cells. Stop the cancer cells by growing or dividing. It will also inhibit or stop the signals from our carcinogens to the cells to become as a cancer. Whatever the cancer cells after death, they will remove fastly from our body, so it will not cause stimulation to any other part of the body. It causes direct death of the cancer fastly, or this can also act to cut off the special nutrition oxygen supply to the cancer cells, starve the cancer cells, so the cancer cells will die. So increase immunity, starve the supply, direct killing, or whatever stimulation causes, that will be prevented, and remove the toxic materials caused by the carcinogen. Next. This is hormonal therapy. Certain hormones are there in our body. This normally secretes when the body, various organs will work properly. But because of any irritation to these organs, the increased amount will cause abnormal formation of the cells, abnormal formations of the cells. So they will suppress or reduce by two ways: by suppressing hormones we are using, or removing some part of the glands which they are secreting the hormones, So this is also used in combination of previous 2 or 3 treatments are there. We also use before surgery to reduce the size of cancer or reduce the risk of the cancer, as well as after radiation, cancer surgery or chemotherapy. They will help to destroy remaining cancer cells. Next slide. So these are called as tumor makers. Wherever any wrong things comes in our body, even cancers, our body start fights and shows certain changes in our body. Various parts of the cancer, they are giving certain abnormal secretions, abnormal products in our body. By detecting these products, we can identify various type of cancers. These are called as tumor makers. In early stage, if we identify these tumor makers, we can prevent the cancers. And it may prevent further type of cancer, because these are the tumor maker substance. They are stimulating normal cell to become cancer. Next slide. Stem cells or bone marrow transplant. Actually, this is not a specific treatment for the cancer, but it is supportive treatment for the cancers. When you are using any type of anti-cancer measures, all the cancer cells will die. At the same time, some normal tissue also get affected. So to get the normal tissues, better way, fast way, we are using healthy cells. Healthy cells, those are producing by the basic, that is called as stem cells or bone marrow. When we are providing to such persons, the stem cells having the proper growth, normal growth of the cells which are damaged because of the cancer therapies. It may be blood cells will increase or any other normal body tissues based on from which stem we are taking the cells. That is called as stem cells. But these are very costly treatments are there. In some complicated cases, those are affordable. It is useful for them. Next. Okay, transplants of this stem cells or bone marrow can be done by the same patients from the healthy parts or by their own relatives, blood relatives are there. It is called as allogenic cell, it is called as autonomous cell or synerginous stem cell from the identical twin, but these are the very rare cases are there. Mainly same person or very close blood relatives are there. So they are helping to recover fast by producing normal cells. Or during the cancer, they will help to increase normal cells more because the cancer cells they are destroying or they are obstructing to form the normal cells. Next slide. This is a very important part in cancer therapy before, during, and after. Emotional and psychological support. Emotional and psychological supports because if they are affecting to our body, so our treatment will not work 100%. Treatment will not work 100%. Like treatment as an accelerator, where the fear, shame, this type of emotion act as a brake to our treatment. So we have to handle this emotional and psychological aspect of the person, suspected cases during the treatment and affected cases. So diagnosis of terminal cases at the end stage, this is very strong and it will affect not only patient but whole family. Whole family. Because if it's male person there, these early members is there. If it is a female wife is there, whole family she is taking care of that. Physical symptoms, social isolation. Physical symptoms like pain is there, changing of certain organs. Social isolation because of abnormal shape of body or something wrong is there. Loss of independence, the person will not perform day-to-day activity independently. Fear of death and negative emotions, they will aggregate. So this fear, social isolations, it will again act as a carcinogen. Family members, doctors, social workers, psychologists, counselor, they are providing emotional support by the different ways and help the people to move towards good health. So family members' role is important at the same of doctor. Social workers are there, psychologists are there, counselors are there, and any other agencies they are helping by various ways to promote their good health. The one agency name is given Hope. Hope is one agency they are helping to holistic oncology patient empathy. Empathy means with a proper attitude approach we are supporting to the others. As it is a cell like affecting to our body, we are taking care of cell, we are helping to the others. Emotions, these are the various stages are there. So it is identified by the Kubler-Ross. Immediately, every cancer person, if it is not properly guided, comes in, there will deny why it is with me, why it is with me, I will not accept, it is not there, I do not having any bad habits. Then you get angers because why it is it the- then it goes to depression because changes occurs, limitation occurs, then they are bargaining. So give me something, then I will dare it to me, especially bargaining with the God also. Lastly, when the clear diagnosis occurs, they will accept. If they are accepting at early stage as much as possible, we can diagnose properly, treat properly, and this, all stages will be removed. Recovery will be fast. That's why this diagram is there. Last, palliative care alternative therapies help to reduce physical complaints, especially pain is there, abnormal shape of the body is there, loss of hair is there. It's next slide, please. Emotional support continuation. Assess the emotional distress by asking the patient. This is a one way we are asking how much you are having emotional stress. Based on that, the various ways and intensity, frequency will increase of emotional and psychological support. Activities like listening up to the music, appreciated message in previous life, looking at the photos where you are enjoyed, they will help more relaxed. The relaxed feeling, free from fear feeling, will help to fast growth of normal tissue and destruction of cancer tissue. Exercise, meditation, perform various habits, they will cause relaxation. Also, they will secrete certain happy hormones in the brain, so the person will happy, active. Be compassionate with the patient, empathetic with the patient, because just we have seen there are various stages are there. They are giving certain some wrong reactions because of the disease. So the family members, friends, physician members are there, other members who are taking care, they should be compassionate or empathetic. Next slide. Social worker helps by providing social welfare services in the form of devices, drugs, materials are there, or transport is there, or in the form of money. Psychologists and counselor, they will help them how to have better coping measures, how to accept it, how to fight against the cancers. Take the challenge, accept the challenge, and fight with them. Spiritual leaders are also important. Positive faith of the spiritual in the God, it gives one type of power to heal the cancers. These miracles are happen. Family members, friends, they support help them a lot to ease or especially social distress. So the person will not remain alone. Next slide. Rehabilitation. Rehabilitation means helping the person with the various ways to become the person to the normal highest level. Normal highest level. That is called a rehabilitation. Help the patient return to the normal life after disease or injuries. So cancer patient have many problems including muscle weakness, various organs are get damaged, loss of certain physical structures are there. So rehabilitation helps to perform the various day-to-day activities as well as improve the quality of the life. The person can perform all the social, working, educational activities with the help of various rehabilitation. Physical therapy important for the physical functions are there in the various cancers because we are removing certain parts by the surgery. To regain that functions, physiotherapy is important. Next. Okay, these are the different ways are there how physiotherapy is given, different type of exercise, strengthening of the muscle, stretching of the muscle, aerobic, especially walking, running, swimming, doing the yoga. This aerobic exercise, it will improve your heart, so pure blood supply to the various body parts, to the cancerous parts, destroy the cancer cells very fast. Prosthetics are used, certain devices are using to perform various body activities. It may for temporary purpose are there. In physical agents, we are using to release certain complaints like pain by using hot and applications, by using acupunctures or any other stimulants. Nerve stimulants are there to improve the body parts activities. Specific functions are there. For example, in lung cancers, improve the expectoration of the sputum. So, throwing out the cancer cells by chest physiotherapy by using certain devices. So this will help improve the respiration. Next slide. So various treatments are used to prevent it, early correct it, prevent the complications, or at least minimize their complaints. Minimize the complaints and ease the life as much as possible. That is called as palliative care. Palliative care is active, holistic care and treatment given to the patient with incurable diseases and short expected time of life. Short expected doesn't give any duration. It may be few days, few months, few years. Relieving the physical pain or both other symptoms are this that will be reduced by using various approaches, psychological approach, social, spiritual, medical approach is there as well as spiritual approach. The aim of palliative care therapy is providing holistic care. All the cares we are providing to improve both patients and close relatives' health because it is psychological trauma to the patient as well as the family members. So palliative care helps to all the members. It includes all various type of cares, all various type of cares. Next slide. Palliative care should be provided with dignity even to the terminal patient. So give the respectful, relieve the pain even the dying stage or even after death. Minimize various complaints. It is challenging, really it is very challenging because near and dear ones, the death is happening day by day and we are taking care where we should not leave the hope. So the recovery will be there or at least peaceful death is important. So talk with the patient till last. We are there to support you. Palliative care is provided at various places. It may be provided at the home, hospital or hospice. Hospice means very terminal, last stage, or very critical cases are taking care. That is called as hospice. Next slide. Okay, this is also new concept. Is the individualizing treatment to the cancer patient. So considering every individual is different, even two members are there, same family members are having same cancers, but the treatment will be different because each person is different in personality. So consider the person, personality, abilities, and their response, supports, and their expectations. The treatment will be provided to the person, and that gives the best and fast recovery and complete recovery is there. One of the research I have mentioned here. With this, they will cure very fast, short time, and completely. Individualized care, considering individual, not only cancer, individual with cancer. Next slide. This is again very small but important part regarding the cancers. Children, very difficult phase when children are suffering with the cancers. Very difficult situation to the parents because they have to take care of the child, they have to manage the social relations, they have to work, and child is not aware about the disease, its consequences. It is a good person not knowing anything. So what parents can do? Few points I have mentioned here. First and important that you are not in this battle alone. They are saying to children's parents are saying, their friends are siblings are saying, you are not alone in this battle. We are together, we will fight and we will win. We are here standing with you and supporting you all along with the ways. Whatever the possible ways are there, we are helping. Many members here also observed that parents are doing all type of actions to take care of the child. They will sell their whole property. They will give all time to children. They will borrow the money. They will ask to the doctors use various type of treatment but save the life of child. Keep all the favorite things with the child. So with this child as a growing stage, the things are important, especially play materials are there, their books are there, hobbies are there. Keep along with that so it will minimize the stress as well as complaints of disease and fear, psychological impact always. Meetings with the doctor, teacher, and child together because the child may be a growing stage going to the school because of the treatment it will remain away from the school. He's missing his teachers, friends, enjoyment of the school. For that, periodically we have to keep in meetings so we get update with the child and how we can support the child after recovery. Stay positively with the child regularly. So the parents' approach, attitude, face, reaction, words are very important. Not only parents, friends, family members, and visitors. They must keep in mind how to approach it. Talk with the child about the disease, treatments, and body changes occurs in simple words. So child will not get any additional fear about this. In simple words, you have to say it is a one type of disease. We are treating it like how we get the injury, it heals. Same thing, some changes will there, treatments are there. We have to stay in hospital. Allowed to meet their siblings, friends with the care because their immunity power is less. There may be chance to get the infections. So the cancer child will mix with the other siblings or friends with taking special care. Keep updated with the treatments of cancers. So doctors are there as well as the parents. They have to find out what is updated treatment is there, what is important treatment is there, which is very important for that. Find out that and talk with the physicians or health team members. Help to take help from the friends, relatives, and all these supporters because these are big battles. If all supporting together, it will minimize its intensity. This is important, especially related to the child care when parents are taking care of child with cancer. Next slide. So whenever we are taking any treatment, allopathic treatments, there will be certain side effects are there, but must keep in mind these side effects are minor, temporary during the treatment. Once it is stopped, the complaints will go off. At the same time, there is again treatment is there for these side effects. So because of the side effects, many times the patients are discontinuing the treatment. Treatment is very important. Minor symptoms, short time are there, minor are there, and they also having the treatment to minimize or to prevent it. The possible side effects are there of the various treatments are there. It may be chemotherapy, especially various body organs. They are losing or decreasing their functions. Hair loss will be occur, digestion will be affected, blood certain cells will get affected. With possible effects of the radiations, there will be diarrhea, hair losses occurs, some oral problems, nausea is there, surgery, some organs are removed, their functions will be affected, pain is there of the surgery, blood loss will be there, chance of the infection is there, targeted treatment is there. It minimize the side effects, but few side effects will be there, even for the hormonal, because still we are finding during the hormones certain dose, it may be sometimes more, it may be sometimes less. So all the anti-cancerous treatment having certain minor side effects are there, but important, these are short duration, they having treatment. Next slide, please. So treatment to the side effects are there. Infection occurs, the WBCs, RBCs are less. We can identify with the peer. Diagnosis is done by the blood test. Infection can occur. Treatment, use hygienic ways, using of the protective ways, masks are there, proper rest is taken, antibiotic is there. In case of anemia, destruction of the RBCs, it's important to supply constant oxygen to the various parts of the body. How it will be identified? Pains and pain is there, fatigue is there, shortness of the breath, confusion because person is not getting sufficient oxygen and nutrition. What is the treatment? Provide the rest, supplementary iron and folic acids are there. In some cases, the blood donation will be given or blood cells are given. Nausea and vomiting occurs, comes out the gastric content out. In that cases, small and frequent foods are used, especially in the form of liquids. Oral care is important because of the bad smell. Again, it may causes again and again. In some when vomiting drugs are given, it is called as antiemetics are there. Diarrhea means liquid stools are there because of the treatment, especially GI oral treatment is there. In that cases, same small frequent fluids are there, use the liquids and some antidiarrheal drugs are used. Next slide. Very common and sometimes it feels shameful, the loss of hair. It is short time. Again, after treatment, it will come to the normal. During the loss of hair should be covered artistically, or use of the wigs are there. Fatigue, hot flushes, weight gain or weight loss is there. Mood swing, body parts, body aches are there. In that cases, these complaints are the temporary, explain it properly and give the relaxation therapies are there. Specific minimizing drugs are given. Emotional and psychological distress, very important is that, especially depression. Very difficult. It has to manage before starting the treatment, diagnosis, and throughout. So emotional support and psychological support, just we will discuss few points clearly. Change of body image, especially when surgery is carried out or abnormal growth of the cancer. Cosmetic things we can use, cosmetic surgeries are there. Processing, artificial things we can use, so we can look much more normal. Swelling occurs, especially in case of blocking of the blood vessels or lymphatic vessels. Movement important, compressing use, the swelling will be go. Next. So this was regarding the how to identify what are the signs symptoms, what the treatments are there, what are the side effects are there, how to correct the side effects. In the battle, one more important part member is working, that is a caregiver who are providing care of the cancer. Especially these are the family members, relatives, friends, they are acting as a caregiver. They are unpaid because these are family members are there, voluntary is there, and this is very long time, hectic and a stressful situation is there. Their role is invaluable and not able to be replaced by anyone. Very rarely, some members they are helping to the family members. They are called as paid workers. So these family members are their relatives, friends, Some supportive members are there, or some voluntary members are there helping as a caregiver. Next slide. Old family members patient can leave tremendous load on the caregivers because these caregiver parents they have to work taking care of child, they have to take care of self, they have to take care of family, social aspects are there and other functions. So it is a tremendous load may occurs. Caregivers is very important, so they need to get all help to fulfill their basic needs to take care of the cancerous patient for long durations without any health problem. How it is possible? Mainly sharing the responsibility among the family members, relatives, friends, social members are there, take care of them. So as a human being, you have to live properly, take properly, exercise, think positively. We have some relaxation techniques are there. So through that, they will get recharged to take care of patient. Next slide. So family members, healthy members, social members, they are also helping in this case as well as government's various schemes are there. Government also helping because it is a major health problems of community. So they are helping in the various ways. Implementation of national cancer control programs, awareness, screening techniques, early detection, and all type of treatments they are providing at the various levels. They are also providing certain health insurance by government and privates as a financial support to the cancerous patient as well as the family members. Special finance support is given for self-development. If the cancer person is able to work certain activities, they are giving financial support to the cancer members. Provide cancer education material, especially these two agencies I just mentioned. There are so many other. Indian Cancer Society is there, and American Cancer Societies are there. They have app, mobile application is there. Through that self, they are getting the information about the cancer, what are the diagnoses, how to prevent it, how to manage it, how to take the follow-up measures, and how to improve their psychological and emotional power. Next slide. Government also providing by various social welfare members to the individuals, to the family members. For example, pre-traveling treatment, pre-traveling for the treatment. PPP activities means public-private partnerships. Government works with the private agencies. Government is taking that financial load, other load of the private agencies for taking care of cancer. They are giving free treatment, especially below poverty line is there. Government hospitals, mostly they are providing free of services. Two special cancer care funds are available. In active stage, they are treating the case as disabilities. So the cancer patient gets benefits of disability advantages, especially during the cancer treatment. Government has made the laws there will be no discrimination at the work or education or any place about the cancer. With the abilities, they can perform the same works. If it is not able to perform, they have to modify the work, but they should not immediately terminate from their work or from the education. Research and development is there to identify the new techniques, drugs, treatments, or preventive measures, identifying the cancers. Research activities will be helped by the government. Next slide. Next slide, please. This is regarding I told app. Shakti app is there. There may be different names are there, but the function is same. They are developed by the Indian Cancer Society and Cancer Society is there to make the awareness among the women to get the proper information and get rid of the fear, shame, or stigmatic feeling. You can download it for the Google and you have to just log in. You will get the information. There is one woman that is called as Shakti Didi. She will interact with you whatever you are asking the questions. It is offline, online, both it is working. Next slide. So in the first part of our talk, I told there are very common cancers are there. Oral cancer, breast cancer, cervical cancer, testicular cancers are there. This is just revision of that. What are these factors are there? Common risk factors are the same like that. It will be tobacco, alcohol, radiation exposure, bad habits are there, unhygienic habits are there, pollution is there. If we are reducing that, most of the cases will be prevented. For breast cancers, simple measures, self-breast examination you can identify is there. And mammography is one investigation is called as. The treatments, various treatments are available and common general measures, taking care during illness, follow, improve their potential activities by supporting, taking proper diet, exercise, so work as a normal, behave as a normal, think as a normal. Next slide. This is regarding cervical cancers. These two are related to the females, breast cancer and cervical cancer is there. Causes, signs, symptoms, these are similar, but just related to particular part of the body. Important care, follow-up is important. Get enough sleep and physical activities. Use painkillers with the help of physicians, guidance. Eat properly. Use extra calories because some cells are damaged by the cancer. Join the support groups and discuss your concerns to your physicians or counselor to get proper help, medical care, psychological care, or financial support. Next slide. This is regarding oral cancer, especially in the male. Nowadays, various thin tobacco products are there. Toxic materials we are using in the form of food or any other kind, starting with the oral cavities are there. So very simple measures are there to prevent, taking care of the oral, proper brushing of the oral teeth, then gargling is there, clean, periodically you have to assess the oral cavity, so early detect it. Some healthy diets, especially vitamin C, vitamin B12, they are useful to take care of oral cavity, calcium. Next slide. This was our hard topic. Why not to fear to the cancer? Why not to fear to the cancers? So no fear, do dare. These are the reasons are there why we should not fear. Don't fear cancer, fight it. Don't fear. It is not death sentence. It is only condition for certain duration. Healthy lifestyle. It prevents almost all the cancers. No fear, take care. It helps to stable your biochemistry because your psychological and emotional health will be stable. So there will be no change in the biochemistry. But certain things are there, especially hormones, enzymes, they will remain same. They will not stimulate to the body organs to form the cancer cells. A lot of preventive information is available and provided. As I told, app is there, healthy menus are there. Whenever you are visiting to various schools are there, they will get the informations. Cancer mortality is only 1000% in the population when they are healthy, when they are taking care properly. Early diagnosis is important, great chance to live longer or live without cancer by cancer treatment. There are so many modes of treatments out there: chemotherapy, radiation therapy, surgical therapy, immunotherapy, individual care is there, emotional psychology support is there, vaccinations also available are there, and most important is healthy habits. So fight with the cancer, win. So many examples we have seen, few of that I have mentioned here. Next slide. Message to take home. This is a summary. This is a special morals of whole discussion. 2 points are there. Avoid or stop using any form of tobacco and consumption of the alcohol. Avoid or stop using of tobacco and alcohol. Diet: avoid fast food, spicy, chili, and stuff that use homemade preparations. Fruits, vegetable roots are there with minimum using outside chemicals. Hygiene of the sex organs and healthy relationship. So couple, they have to maintain their faithfulness and taking care of the genital organs properly. Take protective measures to avoid the exposure to the pollutions. For air pollution, use the mask. Whereas radiation, use the clothes. Water pollutions, use the boiled water. Food pollutions, take the whole food. Use safety devices when you are working in the industries. It may be um, masks, gloves, gowns, caps are there, boots are there, certain specific measures are there, goggles are there. Limited use of television, mobile, computer. WHO, World Health Organization, they are advising altogether the radiation should be less than 1 to 1.5 hours. But even the 1 month child, they are using for 3 4 hours. This is a recent, very dangerous, but most useful thing is there. It will help if you are using with take care and proper techniques are there, proper habits are there. Next slide. Share the information of cancer. Do not feel shame, do not feel shy, do not get fear. If you are reporting early to the health team member, especially early diagnosis, prevention measures will be there. Even no need of the screening treatment is there. If it is need early stage with minimum measures, it will be corrected and you will free from the cancer. Learn the techniques of self-breast examination, self-testicle examination, oral examination, oral taking samples of cervical secretions. Periodical health checkup is important. Early detect will get it. Vaccinations, various vaccinations are there. Free vaccination will be there and recent. I hope we'll get the vaccination for cancers. I'm sure that we'll get the vaccination for the cancers. The example is human papillomavirus vaccine is useful for cervical cancer. Report any sign of the cancer in early stage. Just simple caution keep in mind. Keep in mind cautions. It helps early diagnosis, treatment, and cure the diseases. Be mentally strong, positive before, during, and after treatment also. So these are very valuable golden points are there to prevent the cancer maximum. If it is happen early stage, it will be treated properly, eradicate the disease. Even it is in later stage, if it is occur, it will help for relieve the complex and peaceful death. Next slide. So we have discussed various points of the cancers. What is cancer? What are the treatments are there? What is the supportive role of various agencies, government, and caretaker? Next slide. In conclude, this is our caption. Cancer may have started fight. Cancer may have started the fight, but I will finish it. but I will finish it. So any harmful person may start some fights, like the cancer also, they may start. But what is important? You will finish. How will you finish? Your strong emotions, without fear, without shame, with getting proper inpatient, proper treatment. You will kill, you will vanish the cancer. Next slide. Okay, these are some examples I have given from the various fields. They have fought with the cancer and won the battle of cancer. Yuvraj Singh, one cricketer is there, lung cancer is there, one physician is there, records. Brain tumor was occurred by taking proper care, he recovered from that. Shirley, she was a singer by the cancer, she was affected, but she recovered and she is doing both singing as well as motivation. She is the motivational speaker. In one of the Indian politicians, Sharad Chandraji Pawar, he has also fought with the cancer and recovered, and he is now at 85 years. One of the members, she is a motivational speaker, Shweta. So these are the examples are there. Example help us to take forward to relieve the fear. And that gives the example that cancer is not causing the death, but we can kill the cancer. We can be free without cancer. Next slide. Next slide. So I can say that thank you for joining the war against fight with the cancer. Especially, I am very much thankful to the Institute of Global Professionals. They are providing a very big and large event for me. Today also I have given a lot of trouble, but at various levels they have supported me with the patients. I am very much thankful to you, all the entire team of IGP teams. Especially, I am also thankful to the participants. There was a lot of distraction, but we have managed with your patience, with your support. I have finished this webinar. I hope you will get some information. I think you will become as a messenger for others. When you are saving one person by the information, you will be the great person in the world. Lastly, I say, cancel the thought of cancer. Cancel the thought of cancer. So in any type of disaster, you have to think in that way. I will fight with and I will win it. Thank you, ma'am. Thank you, dear participants. Thank you, ma'am, especially because I had a lot of trouble at the starting and during also. With your cooperation and your kindness, I could able to complete this session. Thank you, ma'am.
Thank you, sir. Thank you so much, sir, for your enriched content presentation also, which can impact our knowledge seekers surely. After your presentation, I hope our knowledge seekers can learn something new, which was our only intention, learn and grow together, IGP knowledge seekers. Once again, thank you so much, dear sir, and for your presentation. Now, sir, it's time for our questionnaire session, which is the more valuable part of our regular webinar. Honorable sir, please stay with us after a short video. We will be back in our session part 2, which is the questionnaire part. Dear IGP knowledge seekers, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After questionnaire, we have webinar certification and online quiz competition. Dear IGP knowledge seekers, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After questionnaire, we have webinar certification and online quiz competition. Dear IGP knowledge seekers, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After questionnaire, we have webinar certification and online quiz competition. Dear IGP knowledge seekers, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After questionnaire, we have webinar certification and online quiz competition. Once again, thank you so much, Honorable Sir, for your time in IGP. We have learned a lot from you with new topics. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable Sir, hope to see you again with a new topic and a new date. Thank you, sir. Take care.
Thank you, ma'am. Thank you, entire IGP team, for providing great opportunity and support also. Have a good
Thank
day.
you, sir. Honorable Sir, before we move to the next webinar certification process, if you want to leave this studio, you can, sir. IGP knowledge seekers, it's time for the webinar certification process, the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online quiz competition and quiz certification. Dear IGP knowledge seekers, it's time for the webinar certification process, the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online quiz competition and quiz certification. So visit www.eduigp.com. Please make sure your presence on our website. Find a running session and get enrolled. After watching or completing part 1 video session, click mark as complete. Moving to the next, which is the learning test, which passing mark is 80%. If passed, back to the course again to download your certificate. If failed, to retake the quiz. Download your certificate in PDF or JPG. For your attention, I'm going to share the procedure again. Visit www.eduigp.com. Please make sure your presence on our website. Sign up or sign in. Find a running session and get enrolled. After watching or completing part 1, click mark as complete. Moving to the next, which is the learning test quiz. Passing mark is 80%. If passed, back to the course again and download your certificate. If failed, to retake the quiz. Download your certificate in PDF or JPG. Dear IGP knowledge seekers, it's time for the most engaging part of this webinar, which is an online quiz competition, which is our regular webinar activity. We changed a few process for online live quiz competitions. Note that after live, no one can participate. Now time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Now time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Visit www.eduigp.com and sign up or sign in. Without this, you cannot join live quiz competitions anymore. Browse the live quizzes button or given link. Find the session name and join with your locked website or user account. Click join and wait for a few minutes for others to join and enjoy an online live quiz competition. After a short video, we will start our quiz session. So our first question is take care of patients that have cancer, cardiologist or oncologist. Option A or option B? Correct answer is option B, and 94% people are correct. And our next question is if careful means to take care, what is the adjective for when no care is taken? Uncareful or careless? Option A or option B? Correct answer is option B, and 100% people are correct. And our next question is which hospice home care can provide care to no cancer patients? AJEB Methodologist Hospice or SAC Hospice or META and HCA Hospice Home Care? Option A or option B? Correct answer is option B, and 44% people are correct. And our next question is you need to take care of colorectal cancer. True or false? Option A or option B? Correct answer is option A, and 92% people are correct. And our next question is where would you take your grandmother who is no longer to take care of herself? Hospital or long term care facility? Option A or option B? Correct answer is option B, and 100% people are correct. And our next question is take care dead. You are no dash young, ever or longer. Option A or option B? Option B is correct, and 94% people are correct. And our next question is no, seriously take care of yourself and take breaks. Okay, or no, never. Option A or option B? Correct answer is option A, and 53% people are correct. And our next question is no way, it wasn't me. I didn't even see your wallet. You should take care of your things. He admitted having taken the wallet, or he denied having taken the wallet. Option A or option B? Correct answer is option B, and 83% people are correct. And our next question is which of the following would take care of prostate cancer? Surgical ENT or surgical urology? Option A or option B? Option B is correct and 100% people are correct. And our next and final question is Athens or Sparta, given women almost no right and forced them to quietly take care of the households. Athens or Sparta, option A or option B? Option A is correct and 33% people are correct. Congratulations to our webinar online quiz competition winner top 10. Congratulations again. We will take a few minutes to finalize the result, and after that we will issue our online quiz competition certificates on our website and official Facebook page, Institute of Global Professionals. Congratulations to our webinar online quiz competition winner top 10. Congratulations again. We will take a few minutes to finalize the result, and after that we will issue our certificates and on our website and official Facebook page, Institute of Global Professionals. At the end of our session, we can say properly feed your skills. Never stops learning because life never stops teaching us. Be happy and stay safe. See you again and again. We want your participation in every program. If you want to live a happy life, tie it to a goal, not to people or things. Albert Einstein. Before I say or hit the end live button, again wants to thank all IGP knowledge seekers for your active participation as always. See you in the next session. Thank you.